This is the anatomical model of the ovary. This is a cross-section of the ovary. The outermost layer of the ovary is called the cortex. The cortex is home to a number of follicles in various stages of development. The medulla is the inner, highly vascularized portion of the ovary. The hilum is the location at which the nerves and blood vessels will enter the ovary. The ovaries lie on either side of the uterus and are attached to the uterus via the ovarian ligament. The ovaries are attached to the wall of the body via the suspensory ligament. Ovarian follicles house one developing egg or oocyte. At ovulation, this follicle will rupture and release one mature oocyte into the fallopian tube. Ovarian follicles that are in the first stage of follicular development are called primordial follicles. Primordial follicles are surrounded by a single layer of flattened ovarian follicular epithelial cells. Primordial follicles will mature into primary follicles. Primary follicles will have two layers of follicular cells. The follicular cells of the primary follicle will continue to proliferate to form many layers surrounding the oocyte. The follicular cells will become granulosa cells. When this occurs, the follicle will be called a secondary follicle. The secondary follicles will also contain a zona pellucida. The zona pellucida is a thick glycoprotein layer that develops between the granulosa cells and the oocyte. Only one follicle will reach this level of maturation. The secondary follicle will mature to form the Graafian follicle. Graafian follicles are fully mature. Graafian follicles will contain a fluid-filled space called the antrum. Many granulosa cells now surround the oocyte. At ovulation, the Graafian follicle ruptures and releases the secondary oocyte into the fallopian tube, where fertilization can occur. Following ovulation, this ruptured follicle will collapse, forming the corpus luteum. The granulosa cells in the corpus luteum will become enlarged. After some time, the spaces between these folds will be filled with the theca interna cells. The theca interna cells will also enlarge and become glandular. At this point, they are now known as the theca lutein cells. When pregnancy does not occur, the corpus luteum will degenerate to form the corpus albicans. At the beginning of each menstrual cycle, about 20 primordial follicles will begin development. However, only one follicle will make it to maturation. This means that only one secondary oocyte is released at ovulation. If you would like to see more of these videos, please hit the like button and subscribe to my channel. Thank you for watching.